I'm ready for my next guest when my team is ready. So we have fellow dentist, Dr. Barry Raphael. He's part of our Dentist Job Connect program. Barry, you have an incredibly unique position for a dentist in New Jersey. I work in New Jersey. You can text Clifton to 215-798-9897. So Barry, if somebody was watching right now and said, you're looking to hire an associate, tell us about this position.
Well, speaking of treatment planning, my practice changed dramatically after being in orthodontic practice for 27 years, doing classic orthodontics, aesthetic orthodontics, being creative with what I did. About 14 years ago, I came upon the realization that crooked teeth were really not the problem at all. In fact, crooked teeth are the body's solution to some other kind of imbalance that's going on. And it led me to see crooked teeth as a symptom, not as a problem. And now I had to look at what the causes of crooked teeth were. And lo and behold, we had a lot more knowledge about that than I ever thought we did.
Cool.
And so my treatment protocols have been more about addressing the underlying imbalances in breathing, in sleep, in posture, in nutrition, and taking a much more holistic approach to the body. I could go into this for hours, and it's such a fascinating thing because now, after doing this for 14 years, it's really catching on with the public. We have people coming to us, probably passing 50 orthodontists on the way to our office, and looking for more comprehensive, holistic solutions to their children's health. It ties very much into the airway craze that is going on now, where people are understanding that dentists have a lot of input into how well the face takes shape, how well a person can use their face for breathing and sleeping, and then of course overall health. So my treatment planning standards have changed dramatically.
I think this is incredibly unique practice style, and I know dentists doing things like you and just changing patients' lives. And you connected with us at Dentist Job Connect because you need help. So tell us, are you looking for somebody full-time? What kind of training would they have? You're in Clifton, New Jersey. People can text Clifton to 215-798-9897. But tell us about the candidate that you're looking for.
So, I'm getting up there in years. I have still lots of dreams. We're improving the practice, but now the practice is growing, doubling over the last 3 years. And I need help. I need some chairside help. What I'm looking for is either a pediatric dentist who has an interest in getting out of the drill, fill, and bill, putting out the fires of decay and really attending to children's health and well-being, and at least willing to learn a bit of orthodontics.
Gotcha.
Not complex orthodontics, but some simple basic skills that'll be used chairside.
What makes it
more than willing?
What makes it? I'm just curious, as a fellow dentist, what makes a pediatric dentist specifically kind of a good fit for this position?
Because as you understand the etiology of malocclusion, you see that the things that are creating the crooked teeth start at birth. And so we have a littles program. We start a lot of our orthodontics with 4-year-olds.
Cool.
And there are challenges, behavioral challenges that most orthodontists just don't understand or want to put up with.
Gotcha.
We also deal with a lot of behavioral issues.
Their behavioral training is an asset to doing
very much. Yeah, that's right. Now, on the other hand, if I had an orthodontist that has good hand skills, is familiar with appliances, can pick up on the chairside techniques pretty easily, but also has the wherewithal to open their mind to treating kids younger, to dealing with younger kids, to understanding the relevance of helping kids learn how to breathe and sleep better from an early age. That's also a big asset to me. And then, of course, the home run would be the person that has a dual degree and is looking for a great way to put their knowledge to work in a way that's going to benefit the profession, the patients, really our whole species, if you really think about
I like
it.
that. Well, you're helping the species. What through Dentist Job Connect, we have dentists out there that can connect with you. You can apply for this position you can text Clifton to this number 215-798-9897. When people go for this, as we wrap up, Dr. Raphael, what's the interview process like? Should they call you and chat on the phone, jump on Zoom, visit your office?
Yeah, I'm going to put them in touch with someone who can get some background on them and what they're looking for, and then they and I will meet and we'll have a long conversation. It's got to be a good fit for both of us.
Yeah, for sure.
It is a bit of a niche practice, but it has tremendous potential for the future. And I look forward to meeting the right person.
Awesome. Well, thanks for sharing with us, Dr. Raphael. Make some comments on the Facebook Live here. We're going to look for that pediatric dentist, the dual degree person, the orthodontist who's interested in this for you. Thanks so much.
Great. Thank you, Paul.
So as you can see on Talking Nachos, we talk about so many different things, from marketing help to Dentist Job Connect, an amazing position there with Dr. Raphael.